All right,
Wait,
good.
can I leave?
You should be able to leave, just stay just like that, you should be fine.
I hate this thing.
You guys are muted. Veronica, you're muted. She's still going, right? She's still
Yes,
going.
I think so.
Yeah. Should we react? Raise a hand? There.
That may be intentional for the moment.
Could be.
Thank
She's
you.
She's not looking at us.
Alrighty. I'm establishing a quorum, so I'm looking up at the screen and I apologize. I may need a little bit of help seeing these. I do see Sarah Wright. And because we are both, we're doing a hybrid, we do have to do all votes by roll call. So, Sarah Wright.
Here.
Good.
Here.
Here, oh. You really can't hear them.
Can't hear you.
Here.
Can you hear us at all?
Can you hear
No.
us? We can hear her.
I am here. Here.
Okay, good. We hear you now. All right. Ethan.
I am here.
Okay. Kelly Steppen.
I'm here.
Right, I see Suzanne Keating,
Here.
Tara Restieri,
Here.
and thank you. And in person, we have Amanda Wright
Here.
and myself. So we do have a quorum. I will now, announce the staff members, Jericho Maley
Here,
and Alexandra
Here.
Richards here. Okay. May I have an acceptance of the agenda? A motion.
So moved.
You have a second?
Oh, I'll second it.
Okay, once again, roll call. So we'll start with Suzanne,
Here. Or,
Sarah,
Yes. Accepted.
yes, sorry.
Sue,
I.
Tara,
Present.
Kelly,
Hi.
Amanda,
Aye.
and myself. So we've accepted the agenda. Approval of minutes from January 23rd, 2025. Everyone should have gotten that in their packet.
Yeah.
Have a motion to approve,
So moved.
Motion I'll second.
okay? Roll call again. So we have Suzanne,
I,
Sarah,
Aye.
Sue,
I.
Tara,
Aye.
Kelly,
Hi.
Amanda,
Aye.
and myself. And thank you again, Lexi, for providing those. Have to apologize. Our meeting of last month was canceled at a late moment. Jericho was ill. Lexi was out of the country, I think, at that point, and I was on the road and we did not have access to the video, so it was canceled, so we apologize for that, but here we are today. Do we have any members of the public? I don't see any, so I assume no public comment. Okay. So, let's get into this. Since we saw everyone in January, the contract review process has gone through this stage of completion. And the last time that we really, the last touch was a meeting that we had, I think it was on March 10th with the Finance Committee, where we presented the report. In your packet, you got the complete report that was submitted to Finance. It was I'm gonna back up because we'll end with that. This round of grants, we somewhat took some of the suggestions, actually a lot of the suggestions from Reftelis and incorporated it into what we were doing. And we are meeting with the contract review committee at the end of April to have a look back on how everything went and how we can improve and move forward. And as using one of Jericho's sayings, we've definitely changed the tires on the bike as we've gone down the road with this. But during this process, we started by reviewing the grant application and improving the grant application. We did a bidders information session. We got a total of 22 applications in. 18 were in Health and Human Services and 4 were in the substance misuse grant area. CRC was divided up and reviewed all 22 applications. We then developed questions. We had interviews. We did not require interviews with everyone. The grant application, we felt as a group, with the changes that we made, we got more complete information in, and it really eliminated a lot of need for extra questions because we found that we were calling people in, asking things that we should have gotten in an application if we had asked for it. So, we didn't require interviews with everyone. If you were new, we wanted an interview. If it was over a dollar amount, and I believe we said it was 100,000, you came in for an interview. I think only 3 or 4 opted not to have interviews, but we did have our interviews. We then successfully used the rubric, and I'm looking up at Tara, you know, that started a number of years ago, and it was done successfully and with gusto, I believe, and acceptance of all people who were involved with doing it. And then we went into deliberations. The rough part of this is we had 1.2 million roughly in ask for 650,000 in the human services end and 175 in substance misuse. So we basically were overwhelmed. Part of it, I believe, why we got so much in the ask is in the last fiscal year, we had an additional grant that we received for youth behavioral health services. We did not have that. We encouraged everyone to apply. So we had some applications from people that had gotten money from youth behavioral health. Plus, I think what we saw with the ask is the need on this island is great. And that was even before, you know, our new federal administration that there's a lot of uncertainty, an extreme amount of uncertainty. But what we did, we broke the grants into 2 separate areas, one in direct services and then in prevention. And I don't want to negate the need for prevention because good prevention helps negate the need for direct services. But with the amount of ask, what happened is we had to lean more heavily in the direct services. And for the first time in my experience, we zero funded a number of the applications. We had one that applied and it was asking for capital improvements, and it really doesn't fall under our thing, so they were taken out of the mix. But for the first time, it was zero funding that we did. When we presented to the finance committee, we made it very clear, and in the report that everyone has gotten, and hopefully it came across in the report as it did when we did a presentation to finance. We need more money. I was corrected in the presentation because we know that the substance misuse or the old cannabis money, as it used to be, the cannabis grant, that fund source has gone away. And the past year or 2 years, it's come out of the
Strategic Stabilization Fund.
st-
Do you want me to,
strate-
do you
yeah,
want to do like the 30-second?
yes,
So up until now, the substance misuse grant was funded through impact fees that were collected from the cannabis dispensaries on Nantucket. The state of Massachusetts ruled that impact fees could not be assessed in bulk and had to be demonstrated, which we could not do. So the funding source was switched to a combination of a strategic stabilization fund and a portion of the tax collection. The taxes collected on recreational marijuana sales. There is likely to be some monies available from the tax collection, but it will not meet the same $175,000 threshold.
Right.
I think that's what where Brian was
Right.
going with that.
because I said a few times in my presentation that the 175,000 is going away, and I was corrected in saying yes, that funding source is going away, but there will be some money that will be allocated for substance misuse grants. However, even with that, we haven't had an increase in the $650,000 in a number of years, and 2017, 18, something like that, and the route that we need to take, and hopefully by our next meeting, we may have a draft of a letter. The letter will come under Jericho's signature, but we need to approve it and support. Basically, we need to be asking for more money, and I believe the approach we're gonna be taking is we'll take the 650 and the 175 and put a cost of living over the years that we haven't had an improvement, and I said an improvement and an increase. And I believe we came up with 15%
That is.
in that amount of time, 15% of a inflation factor.
That number is gonna need to get looked at a little tighter to get the specifics of it. My first goal this year is to ensure that we have the 825 or the 875. It's 175 plus 650, so 825.
Right.
To make
825.
sure that we have the 825 level funded at least.
Right,
And then through the next budgetary cycle, hopefully get a ongoing adjustment for cost of living.
Right.
That would be sort of where I think we would go. We're unique. Most budgetary requests are made after the start of the next fiscal year. Most of the budgetary requests need to go into the finance department and town administration by December of the
like
previous year.
So what you're saying, typically it would be by December of 25 would determine what would happen for fiscal year 27, which starts July of
So we-
26.
So
But
what
that's
we-
too late.
Exactly. So what we have to do is we have to get our request in a non-standard manner in order to secure the funds, so we know how much money we're gonna have to give out in the grant cycle. The idea or the hope is for this year to establish us at the same rate as we had last year. And then, I mean, if possible, a cost of living, inflation, et cetera,
Right.
adjustment would be good because it has been substantial, especially in basically the last 3 years.
Right.
But
It was not the appropriate time to do it, in the beginning of March to, talk about fiscal year 27 when everyone is focused on 26. So we will have that ready to go basically after town meeting. And we'll probably get it in people's hands before, July 1. But we are gonna wanna have an answer, I'm gonna say by August 1, because this cycle is going to start up even earlier next year than what we did this year. So, just trying to think anything else.
I have a question.
Yes,
Could you perhaps also, as a backup and also for supportive sort of information, solicit some data from some of the organizations to show sort of the increase in the cost of services over certain periods of time to then have that backup so that, you know, it could be greater even than 15%, but it certainly, I would assume that over these past, you know, a few years, those costs of services have certainly had to have increased. And I think it would be great to elicit some of that from the organizations, because then they know, number one, we're actually out trying to fight for more dollars, so they get that sense. And number two, that the town recognizes that, you know, that we have this kind of communication line with all of our organizations, and that we get, you know, we're consistently getting data from them, that sort of thing.
yeah, we do have, some of that information in, and you'll see it in the packet.
Our report.
Where you could see year, just maybe last year over this year, number of clients served. So there is some of that could be gleaned from it, but that's an excellent thing to go to some of the organizations because they will know where the costs have gone up.
Well, the other thing is it's very uneven. Food costs, for example, have gone up significantly higher than a lot of other things, especially for staples.
Right.
So it's not an even balance.
Oh, I'm sure it's not, but I think if you had an average across, you know, it would
Yeah.
at least give you, you know, a greater sense of where, you know, where the mean, median and mode are.
Yeah,
Agreed.
Amanda?
Sorry, and just to add to that, I think given the state of our country and with this new administration, there's more and more cuts coming out. And so there's gonna be a lot of grants that won't be offered. And so I think it'd be interesting to hear from organizations who rely on a lot of grants, you know, what they're getting funding for, and what they're not.
Exactly.
Actually, it might be a
Yep.
CHS meeting.
What's that?
That might be a CHS meeting, like in the
Right.
future, that we ask them to come here and present that information.
Yeah.
to us. We've had a lot of calls on this particular topic right now. We're probably secure for everything towards the end of this fiscal year, but that's only June. Past that, there is no way for us to tell because it's being applied in a capricious manner.
Mhm, right.
That's really just how it goes.
Changing daily. Yeah.
I think Rocky was on a call about this earlier for public health questions. I've been fielding questions from staff and from other agencies, about how how things are gonna be impacted, how federal changes are trickling down. We're trying to figure out what things are gonna look like everywhere from the vaccine in the coming
Mhm.
fall, whether or not there'll be any available, whether there'll be an approved vaccine for a couple of conditions this year or not, which we do not know. So all of that's up in the air. There's very little planning we can do about it because it is done specifically in a way to be difficult to plan for. The state of Massachusetts seems to be making a very solid commitment to certain core health services. And we've been talking with a couple of rural health organizations about what we can expect for next year. It's gonna be rough going, I think, and there is going to be less available funding and support, on the federal level, from the federal government coming into the state. But, there's a definite solid response being developed at the state level, and that's probably gonna maintain a lot of this, not a lot, I can't say how much, but it'll maintain some degree of service delivery in a lot of core elements and vaccines. And I'm hoping on the state, for the behavioral health work that they've been doing lately.
Just one last thing to circle back around to presentation. In the substance misuse grants, there were 4 applicants. And one of those applications was not accepted because the application, the applier, the organization did not have not-for-profit status when they applied, or even when we interviewed them. And it sort of came out as we were peeling the skin of the onion, the layers of the onion. So that was bumped out. And what happened with that is we 100% funded the other 3 applications. But with 100% funding for the other 3 substance misuse grant applicants, it left about 34 or $44,000 on the table. We made a formal request if we could take that, because they are 2 separate grant streams. If we could take that $44,000 and move it over to human services, and the answer was a hard no. And the reason is because the substance misuse comes from a different bucket of money and it could not be moved over. And we were hoping we'd be able to use that in the human services side because the need was so great there. When we did our deliberations, we then went and asked to see if we could have this moved, and when we came back and found out we couldn't move that money, I offered to open up deliberations to see if we wanted to reconsider, but the committee felt that we did deliberate long and hard without that money, and we left it at that. So, it was an extremely difficult process, knowing that the need was so great and we did not have enough money for funding. So that sort of like, that's where we are. One last thing, we will be doing a award, I don't want to say an award ceremony, but we are going to invite the recipients to an event, and we'll have to plan that probably for June potentially.
I'm thinking June, early
Um,
June, probably.
early June, that we will, basically pull people together and make the awards. And the other thing that we talked about also is in the contracts, there will be a line that says that if you've received town money, we would like you to put funded partially or funded with the town logo on that. Because we want people to know that our tax dollars are helping to fund these organizations. So a little bit better advertising along that line too. So I think that's it for,
There's one other tiny matter that's CRC related, which is the opioid substance grant
Okay.
cycle.
would you take that?
Yeah, and we can roll that into, if we want, with your
Great,
permission, I can
yes.
skip to the Human Services Director report real quick.
Sure.
So just because there's not a ton to report on human services right now, there was a large class action lawsuit that the state of Massachusetts was a part of that had against various manufacturers of opioids. There was a large allocation made that was to the state of Massachusetts, which has been split down on the municipal level. The first collection of that funding will be available hopefully in a grant process that, well, sorry, the money is available. We will be running a grant process for a total of $55,000 in either 1 or 2 awards that have to do with opioid misuse or substance misuse treatment that can apply to opioid disorder. There's a couple of last minute guideline and use restrictions on that money that we just got delivered the last couple of days. So I'm gonna apply those to the existing substance misuse grant application. We'll run a grant cycle before the end of this fiscal year, make an award on that to a substance misuse service provider. And then execute that contract and agreement over the course of the next fiscal year. So that money should be available starting in July of the coming year. So that'd be a second out of sequence grant cycle that we've done in the last 2 years. Then that is the primary human service thing happening right now. Aside from that, we've been doing some work around, we've been working on some tick mitigation stuff, We've been following up on some bird flu related questions and messaging. And then it's been some prep and internal work around getting ready for summer events, including some QPR classes that we're planning on trying to get wide now that we have a larger number of trainers available on the island. That's, I think, probably a fairly good summary of the human service director bullet point.
Okay, is there a question
Of
on
course.
QPR? Is there a place that people could go and see when those trainings are gonna take place?
So all of those trainings are gonna be on the AC Cares calendar. Just for everyone's interest on the committee, we have a town-funded human services resource guide, which recently had some additional functionality put on. The guide is a webpage called accares.net. At accares.net, we have a curated selection of human service related resources. There's a bunch of Quizlets and other information, but the thing that we're really excited about right now is a community calendar where providers can sign up to this webpage. It's very simple, a very simple registration period. They can add their own events and content in there. And then we're trying to use that as sort of a centralized point on which we can be driving traffic to this resources page and then also help coordinate what is and is not available. All of our QPR should be available on that once it's scheduled. What we're currently doing is we're trying to bring it to, we found that having open entry ones is difficult. It's a heavy subject matter that a lot of people don't realize it's necessary. QPR is a behavioral health crisis program that is specifically geared towards noticing signs of distress and then providing people with connections to support and resources to prevent behavioral health crises up to and including suicide. So it's heavy subject matter. What we're trying to do now is bring it to useful groups of people. We're aiming at employers in high stress positions. We're looking to piggyback on Restaurant Week. We're also working with the Chamber of Commerce, and then we're going to try and incorporate it into a couple of other public events and have it be sort of a stealth behavioral health education and outreach approach where we introduce you the concept of it. We have some people who have taken the classes, and then you have an opportunity within an hour or so to take a 90-minute class on it if you desire. So that's what we're looking at. We're really trying to line those up with some, with the, immediately before the start of summer and then right after the start of summer, right when the stress up and stress down periods are, and when there's still a little bit of free time around. But yeah, I think that should cover the QPR. Yeah.
I know just listening to select board last night, they are hiring a new, I think it's called social media now. It's not public, information
information officer.
person, whatever. So they've changed the job description or whatever. I guess one of my frustrations is there's all this good stuff happening and people still don't know about it. And I don't know what the process is to maybe feed that through that pipeline, that it could be upfront on the town's website, that people can see what's out there.
I'm definitely, we actually have a comms meeting, we're doing a revised comms and webpage discussion for the health department tomorrow and then into next week.
Mhm.
So we're looking to revise at least the health department webpage.
Okay,
I do not know how much further we can push it. We do have the Act Cares page as a link that's available, it should be available on any web page on there. It should be in the resource link.
Mhm.
And then that's what we're trying to centralize that part in, because of the significantly higher amount of like regular maintenance for the resource list like it is. That's a separate vendor. It's not hosted by the town site because we don't have the manpower to update and maintain it to the degree it is. So we have a contractual relationship with Trilogy, which is, I think, the nationwide standard for municipal resource guides like this,
Mhm.
or one of the big participants on it. So we're driving traffic to that, and I think we're gonna be having a revised health and human services social media approach, and so we'll be centering equal amounts of health and behavioral health on that. So that would be where we would be doing a lot of our like immediate reach out or advertising. I am curious, I was talking to Rosemary at CSBH about, she had some success with social media advertising. So I'm wondering if that's something that we might be looking into for highlighting specific health and human services, either opportunities or needs, specifically stuff around the needs assessment that's coming up this summer, fall.
Right, right.
Maybe great.
Quick question.
Yeah.
Oh, sorry.
I'm sorry, I know I
Okay.
didn't raise my hand.
Okay, first Amanda.
Yeah,
I think it'd just be great with the summer coming to really let people know about the Act Cares. And then like they'll know like this is a place that you can go and see what's going on and partake in other activities. I think a lot of the people that come here just for the summer have no idea.
Yeah, and I know one of our approaches, so we've been talking with culture and tourism about cross listing,
Oh,
certain
yeah.
events across there, doing additional public, publicizing for the right kind of event, and then sort of making it so that clinicians, service providers, and the public are kind of in the same feed so that they can see the same stuff, and that people are realizing how much crossover in all these areas there are.
Mhm.
The model we're following, there was I believe it's Amarillo, Texas, has a instance of network of care that is, like their calendar is called from like 7 or 8 counties, and they have like 12 to 15 events every day of the week. That's all directly human services
Mhm.
related. Once we started with behavioral health to build out the resource list and the calendar. It's equally applicable to all human services on island, senior services, health, like health, food, wellness, all of those things. We're also going to try and build in a requirement for advertising events that we fund through contract review committee on this,
Mhm.
or at least participation on the network of cares and ongoing messaging about what the grant is doing.
All right, Tara?
just a couple quick things. One, just a side note on the bottom of Act Cares, if you click on their Facebook page, it goes to the network of care in Texas, just so you know that.
Mm.
Is there a way, or are there restrictions to have, for example, an Instagram page specifically dedicated to, to advertising kind of what we're supporting? So this is a little bit back to the grants, which is one of the things that we've done in Connecticut is we actually use the Human Services Instagram to recognize the organizations that we partnered with, and then we kind of continued to actually have that feed. And then we have the organizations put up at least, as often as they can, anytime they have an event or they have on there that they are supported by the town and by human services. So like, it's kind of a little bit on both sides that if, you could use the organizations and make them, you know, to their, because that's going to spread out to more people in town. That because, you know, not everybody's going to follow the same organization, but you're across the board, you should be able to cover a bunch of people. And I would suggest that we also reach out to our partners and ask them to publicize the website, for them to publicize, you know, Act Cares.
We've definitely done that latter part of the approach. And we've done a lot of direct outreach to the Healthy Community Community Collaborative facilitated through the Community Fund. And we've done a decent amount of direct messaging to senior providers, to like we had office hours, and we're gonna do a couple more rounds of these, especially when we're doing the agreements for this year's grant recipients. Unfortunately, the town of Nantucket has a centralized comms department, which is currently being built out. So
Yeah.
our social media plan is contingent upon the social media plan of the other, of the comms department. And what we're trying to do now is work out a method where we maybe have a dedicated page specifically to health and human services issues. Because as it is right now, I don't think we have an active Instagram, Twitter, or Facebook account specifically for health and human services. Obviously, from the town's point of view, they would much rather have a single centralized comms department doing outreach rather than have independent departments running their different comms things. But we're in the process of ironing that out right now. And we have plans that should address the point that you're discussing, but they're not finished yet, so I can't really talk about them until they are.
Got it.
But there is like Natural Resources, I think, has their own,
They do.
you know, which
and
they, you know, put a good feed on that, so,
They do an excellent job on that.
right,
They predated the existence of the
Okay.
comms department, and
Alright.
so they already had that.
okay,
We're definitely trying to figure out a solution to the communication bottleneck
right.
that happens, but the staffing and like the comms department is like a year and a half old, so it's just taking time to build up. I think it's a year old. So yes, broadly, we're gonna be exploring a variety of new and different ways to communicate out on this. I wanna focus on being the spine or the river system that allows nonprofits to expand their reach. And really I wanna be working with them where we're sharing content for them, they're sharing content for us. And we're all driving traffic to each other and to the calendar so that, because at the core, the analytics are about getting people's eyes on access to services or need things that they need, rather than the analytics themselves. So whatever we end up doing that the metric I'll be using for seeing how successful our social media is, are the baseline analytics of views, et cetera, but also click-throughs, recommendations, how much traffic is driven to the calendar site, how many links out to those various listings there are, and then try and kind of get the right combination of tone and content that gets people looking at these, that then lets them come to the event that they're celebrating as much as anything else.
And I guess we started this conversation because of the QPR,
Mhm.
and, you know, I do know that there are more trainers now, and, you know, the need is there.
Oh, yeah.
And, people need to know that it's happening.
So we've been running those for 2 years. And I know Fairwinds was doing them for a while before that. We've had good turnouts, we've had bad turnouts, we have not had consistent turnouts. And we haven't hit the point where where it's a sort of self-sustaining system where people who graduate recommend it to other people who tell it to do it. We're getting there, but it's the model or the thing that I always default to because of how I started in this field is clinics. And we had really great success at high demand points for clinics. But once it turns to convincing people that this is an important, valuable thing for it, you need to find smaller, more manageable groups of people to address directly. That's usually workplaces or affinity groups of some sort or another. So what we're gonna be doing is trying to directly aim our outreach to make sure that all of our trainers remain qualified so that we have, everybody gets the requisite number of classes to teach. We're doing a ton of them at the library. They've been a fantastic partner on all this stuff. And, you know, that sort of approach worked well in clinics
Mhm.
for vaccines, and QPR is the closest thing we have to a behavioral health vaccine for some of these.
Right.
Like, it's the only population level intervention that has evidence-based backing supporting a decrease in behavioral health crisis at the population level. So we need to crank that number up. We need to get it as part of an organization that is self-identifying to people, that people know that there are people in the community that are trained in this, that know how to connect people to resources, that are safe places to communicate and talk to. And then that needs to develop its own identity and associated
Right.
group along the way.
Okay.
I have a question.
Yes,
Does the Nantucket Foundation that gives the grant money have an Instagram or a social media?
That's a good.
so you mean.
Yes, they
Because-
absolutely do.
Yes.
Why
Yeah.
can't we just put a bug in their ear about putting things up to the groups that get the money? Or,
We-
in some way,
We
They do
definitely-
that. I was gonna say, they do that for the people who get their grants,
And
okay.
we-
sure.
And they've been immensely supportive of any social media messaging that we send their way as well. It's not a formal arrangement yet. What I would like is for it to become something similar, where we're doing, we're coordinating on outreach. And what I really want to see is us coordinating on grant funding, because, it would be awesome if that organization could fund things that we can't, for example, or could fund programs that we can't until the next fiscal year, for example, or would assist with startup funding in ways that the governments cannot do. And certainly to help transition organizations to longer term stable funding through a variety of funding sources. That is, I think, a really important part of a partnership with a private philanthropy organization like CFN.
okay,
And I
But-
just wanted to make a comment. I've attended a couple of the QPR things at the library. And they really well presented and good programs.
I like it.
thank you,
Well, I think it's a meaningful and useful thing.
thank you. All right, we did touch a little bit on the,
Consulting.
needs assessment. Can you give us an update on where we stand with the needs assessment?
So to step back briefly, most of us participated in the Raftellus study about the Health and Human Services grant cycle and funding process. Their major recommendation, the single biggest recommendation they had, was that we need it's called a comprehensive community needs assessment. It's a specific type of needs assessment that covers a broad range of different sectors that hasn't been done on a comprehensive level since, I think the latest one that I found was actually 2008. And that was a comprehensive community needs assessment that was done by a particular contractor that is still around, but I haven't been able to contact to get whatever records they have available to. The other component of it is that the community needs assessment tends to be a variety of survey instruments. What I'm also gonna try and build into this particular needs assessment is to compare us a little more granularly and with a little bit more nuance than the Raftellus study did to similar communities elsewhere. And then also to look very much about what gaps we have in human services delivery compared to other organizations. So this is a survey-based needs assessment with a data analysis and data and benchmarking component.
Where are we
Bit of a
in
gap.
this, where are we in getting this done?
So at the moment, we just closed the solicitation period. So we
Okay.
had a request for proposals up. It went for, I believe, 2 to 3 weeks. We got 11 people who applied to it.
Wow,
What we need to do now is we'll need to get, there's a proposal evaluation rubric. There's going to need to be a small group put together of people who are going to be both helpful for the process going forward, so other stakeholders, and then members of both this body and contract review committee to evaluate the proposals and then do the rubric grading. I
When will you be ready for that?
I will get the packet with I'm gonna get the packet with all of the applicants either tomorrow or first thing next week. We closed last Friday with 11 applicants.
Okay.
The record for any, bid like this is 4. So we almost, this is the person in finance who was managing the procurement software side of this was like, you got like 3 times as many applicants as this usually gets. I'm thinking that there are a lot of agencies that were probably gonna be doing these assessments on federal grants that are now looking for other funding sources as well.
Exactly, that could be
So I'm
too.
gift
So-
word in mouth there.
How many people do you want in that committee?
So this is procurement law based, so it will be in consultation with the finance department. Who and from what areas. I think a small number is probably ideal. I would guess 5 individuals. My suspicion would be maybe 5 to 7 individuals. It's gonna be myself, members of this committee, and then a couple of stakeholders or shareholders that would be really helpful to have on board once we're actually doing the needs assessment. So we're looking for other nonprofit agencies to help, like either other nonprofits or other health and human service provider type people to do that.
Okay, so would you want 2 volunteers from CHS and then some volunteers from CRC?
Yes.
Okay, so if anyone is interested, and this
Should
would be done in person, I assume, or would it be done
So
in a hybrid?
The rubric would be done independently online. Discussions about the rubric, we could do in whatever capacity we need, but this is a full procurement process, which has some specific requirements about
Mhm.
how we're doing the rubric. It'll be done through a NeoGov, through a software platform where you're actually filling out the rubric that's been put in through that.
Mhm.
And it's one of those situations where it's gonna take us, it's gonna be like, part of it depends internally because it's procurement law, so I don't know if it requires 1 member of the finance department to sit in.
Right.
1 member of admin to sit in, so like 2 volunteers from either from this board and
So
CRC
2 and 2, maybe?
would be probably, we might get 1 and 1 plus the other shareholders, and then we'll figure it out. But if you're interested in evaluating the consultants that will be doing this, please feel free to send me an email, and I will put you in the pool as soon as I'm told what the specific requirements
Okay.
are. If they give
So 2 from here and 2 from CRC.
And
Okay,
it would be reading 11, I think the average length of these was about 10 to 11 pages, grant proposals, and then rating them across what I think is an awesome rubric, although I read it, or I wrote it, so I can't really be trusted.
of course it would be awesome.
It's
then.
fantastic. I mean, I did it. But at the same time, this is a more objective rubric. You should be able to read this and have an answer for these based on what's in there. There's very little subjectivity in most of them. But if you're interested in that, send myself or Lexi an email on that, and we'll put you on the list.
Okay, all right. Moving on, in the packet, you also got the complete consultant report from Rostellis. When we met in October, we only got basically the PowerPoint, but now we have the complete, and it is quite lengthy. I've got it in front of me here, and I read through it last night, and there's a lot in there, but I think that the next step is we will be getting the CRC and CHS together. I know that Jericho and I are sort of getting some background information of what the steps are if we are going to combine the 2 groups or with the options. So when we meet, we'll have some answers, and as opposed to just saying, this would be nice, that would be nice, we have to find out what we actually can do. So that's being worked on. But please do in preparation, take time and go through and, there's a lot of good stuff in there for sure. Human resource, the report you basically gave us.
Yeah.
Already. I'd like to next turn it over to, actually Sarah. Had sent a email with some subjects that she wanted to talk about. Under item number 7, which is community human services related items, from members. So please, Sarah, you have the floor.
Okay, thanks so much, Veronica. I just wanted to give some quick updates on immigrant resources, the Transportation Task Force, and insurance counseling. So I have talked to some different folks recently. I won't name them here, but we probably all know them, who I think are either members of the Unitarian Church here on island or very involved in the Unitarian Church is kind of how I first learned about this. And I don't know the complete history of, or even the partial history of the Immigrant Resource Center on Nantucket, but I think it was closely aligned there. So sort of makes sense. Anyway, I have talked to a few folks there, and what I have learned is that I've learned a couple of things recently as it relates to all of these issues. So when there are, and I'm not disparaging our neighbors on the Cape, but oftentimes we hear, the Cape and the islands, and I've only just learned in the past week that sometimes that means the Cape and the Vineyard, sometimes that means the Cape and both islands, but oftentimes I think it just means the Cape. So, but anyway, so there are some folks in Hyannis who I think that's really where the Immigrant Resource Center that I'm talking to when I need to talk to them now is located in Hyannis. I think there is still a group here that I know they have helped a couple of our patients when I've reached out to them recently, people needing to get to immigration hearings, for example. So somebody among that group recently said, for instance, oh, this raises an important issue. Like, do we have a fund on Nantucket that is specific to, things like either immigration hearing related travel? I mean, we have other travel funds, but they're all medically based needs. And again, just back to what we've all noted here earlier, like, what's going on at the federal level. So I know this is a very caring community. I know our friends on the Vineyard and on the Cape are just as concerned about the same issues. And so I appreciate any and all help. But I specifically want to mention, it relates to the talk about the calendar. This Saturday, March 29th, there's a group called Source Hub, and they're based out of New Bedford. The founder, I believe, is bilingual Brazilian Portuguese speaking Fernanda Silveiro. I can't remember exactly, but she and one of her colleagues are coming this Saturday to the Nantucket High School from 11 a.m. to 2 p.m. And there's it's called the Legal Clinic and Community Resources. Get free expert advice from attorneys in the following areas: family law, workers' comp, immigration, etc. And it also says Mass Health and Health Connector application renewal, ITIN application, there's a fee associated with that, and change of address with immigration. So I saw this in the last week or so, and I have no idea, cannot remember where I saw it. I don't know if it was Daybreak. I don't know if it was I have no idea. But the event itself is co-sponsored by A Safe Place, which is great. I encouraged Fernanda to put this on AtCare's calendar just yesterday, so I think it is there now. But I think, people in New Bedford, when they come to do stuff, they have no idea what all of our calendars are and how to access them. So now she knows, and I've mentioned it here a couple times this week on our morning safety huddle. So The two people coming are both bilingual, Brazilian Portuguese speaking. This is going to be at the high school from 11 to 2. That's that. And the, you know, segueing into the transportation task force, the transportation task force is, Jericho's attended a couple of times, or all 3 times that we've met so far, which is great. We did not meet in the month of March, and we're trying to get that back on track as the busy season approaches, but we're also trying to expand the people at the table, because for the past 3 months, it's really been hosted at the Community Foundation with folks from the Nantucket, the Senior Medical Travel Fund, the Nantucket Food, Fuel, and Rental Assistance. I know Family Resource Center was represented at 1 or 2 of the meetings, the hospital. And then Nantucket Regional Transit Authority was there for at least 1 or 2 of those meetings also. The consensus at the last meeting was that we need to invite now people from the High Line, the Steamship, Marine Home Center, which I've done just in the last 2 days. Then we're going to invite people from Cape Air, Gull Air, and there's another place that I'm forgetting. But we're really trying to get anyone who has anything at all related to, in particular, medical travel to gather every month so that we can gain some efficiency and not duplicate effort, really. You know, there's a lot of overlap. So anyway, that's the short version of that. Nantucket Food, Fuel, Rental Assistance and we did meet earlier this month, and we know that there is some duplicative effort going on right now, but this goes back to a point that someone just made a few minutes ago. I think the bigger issue is that people who need help with medical travel have no idea, absolutely no idea where to go for what, why, or, when. So, so I think that is, creates a lot of administrative burden. I think the costs are increasing, and there is, I think, a role that is specific to government and infrastructure. I think there's a part that is related to the nonprofit organizations. And of course, the philanthropic community has funded all of these existing travel funds. But again, if people don't know where to go or how to access them, then it's inefficient. Right. So, and then the last thing was immigration, transportation, and insurance counseling. I just wanted to, as I just said, the Source Hub people are going to be at the high school on Saturday, and they can address certain concerns, I think, related to Mass Health and Health Connector application and renewal. Here at the hospital, where we have 2 community resource specialists, one of those folks has been out is on a leave and has been out for a little bit. So we're really just functioning with one, and that has had an impact, of course. So the one person who is doing that here every day is booked out, I think now a week or a week and a half. So if you know people who need insurance counseling, Mass Health or Health Connector in particular, don't delay. Please call the hospital, call the social service office, email me, and we'll get something booked for you. But we never want anyone to be uninsured or to have even just a short little gap in coverage, because you never know, that might be the time that you trip and fall and you need surgery or something. So you don't want to run into delays for lack of access and coverage. And I think that's it. Thank you. I would like to also, on a personal and professional note, just wish my social work colleagues here at this meeting, it is National Social Work Month. The theme this year is compassion and action. So happy Social Work Month. never,
you.
ever in my
Yes.
lifelong social work career have I celebrated this month when 10,000 people have been cut from the Department of Health and Human Services. However, we can celebrate nonetheless.
Right. Well, we celebrate the good work that you do, so thank you. South Coast Legal is one of our grant recipients and has been for many, many years. They also provide some immigration advice, and they're at the Salt Marsh Center. Jericho, do you know what day they come, or is it varies?
Varies as necessary.
Okay.
They generally have someone down once a month.
Right.
And then I've also, there's a number to call to put you on their radar should you need resources. Their webpage is, what is it, sclss.org, I believe, South
Right.
Coast Legal Services.
Services. Right.
SCLS.
But beside, family benefits, immigration, elderly law, but immigration is one of the things that they do, and we have funded them. It's basically volunteer. They're attorneys who volunteer. We pay with the grant just to get them here and back to the Cape. So another resource. But looks like the event on Saturday at the high school would be a very good thing to for the island. So thank you for sharing that.
And I believe there should be a fact sheet going around with both South Coast Legal and a variety of other immigration and legal resources. I think Mira is on that list as well. Mira being, I think, a large umbrella organization that serves most of the Northeast for immigration resources. And then there are two other agencies that you should be able to find on that sheet that are connecting people to pro bono lawyers doing specifically immigration work. And the need for that is probably very high right now.
Okay. Thank you very much, Sarah. Appreciate that. And yes, anyone who wants to share, that will be a standard item on our agenda. So appreciate that very much. On to other business. Couple of things. I know that everyone gets emails on occasion from Maureen Coleman on conflict of interest or on open public meeting law, whatever. I attended the conflict of interest this morning. I've done it a couple of times, but they offer them sometimes. They did it in person here in the fall for open public meeting. But when you get this, if you do have time, please sign up. It really is a valuable thing. It sort of keeps us all in tune with
It's also
what we're doing.
required.
It's also it's required, but it keeps us, it keeps us in tune with how we should be doing things for certain. Other business, I have just two things, one more. There's a number of people that are their time is up. What is it called? I'm sorry. The terms, thank you. Ding, your time is up. And you should be getting an email from the town office that will notify you of that. But I think what I'm gonna do is I'm gonna ask Lexi if she will just send an email to the people that are up. And if you are interested in continuing, you have to submit your application. I don't think they've announced when they're going to be due yet, but it will be happening over probably end of April and in May. And the appointments are done in June because it starts July 1st. And we also have one position on CHS that still has not been filled. And if you know of anyone, we don't have to wait for that cycle. Please send them our way, and they will review that even out of sync or whatever. So if anyone knows, put a bug in.
Put it above, yeah.
All right. Other business. Anything else? All right. One thing, and this is just a thought. I've been at a couple of community events recently, that Chief, Jody Casper has been at. She's very visible in the community. And I don't know if, I know that we've never had her come to one of our meetings and, I would like to, at one point, invite her. Because, I'm a firm believer in community policing and, I think that she, you know, hopefully supports that also, but I think from what I can see, her time on the island, I think that's very much, but I think that for her to hear of the things that are going on this level may be an important mix of her further, it's been over a year, right? That she's here? Do you know when she
Yeah, I
came?
think it was January
Is it?
of last year.
Oh, really? It's that long?
Yeah, I think it's been, yeah.
Okay, so at one
March.
point, I'd like to invite her to come to one of our meetings. So that's just my last thing. Anything else from anyone? I apologize for the hiccup we've had. Whether our system is being overused here or just tinky, but we've had a number of false starts just trying to get the system working, so apologize for the hiccup before. And our next meeting is on April 24th, at 4 o'clock, which is right before Daffy weekend, I guess, right? That's Daffy weekend? Yep, all right. So, with no hands up or whatever, do I have a motion to adjourn?
Do we have enough? Do we have enough people? No, we have
Yep.
long, okay. Motion to adjourn.
Do I have a second?
Second,
Okay, Suzanne second, so we'll start with you, Suzanne.
Suzanne says aye.
Aye, okay, Sarah,
Aye.
Tara,
Aye.
Amanda,
I.
and myself, aye. Thank you very, very much. And I felt like I was talking on like the FedEx commercial, but we did get it done and it's only 5:18. So thank you very much. Have a great night, everyone.
Thank you.
Bye.
Bye.
All right.